Welcome to our channel, your trusted source for life-changing health information. If you're passionate about staying healthy, living longer, and understanding your body better, especially as a manure in the right place. Today, we're rediving deep into a subject that affects millions of men worldwide, but is often ignored until it's too late. Prostate cancer. Now imagine if you had the power to protect yourself from one of the deadliest diseases affecting men today. What if you could recognize the signs before it's too late, take control, and possibly save your life? Prostate cancer is often called a silent killer because it develops slowly and quietly. But don't let that fool you. According to the National Institutes of Health, it's the most commonly diagnosed cancer among men in the United States. Even more alarming, it's the second leading cause of cancer-related deaths in American men. 1 in 8 men will be diagnosed with prostate cancer during their lifetime. In 2024 alone, over 30,000 lives were lost to it, and in 2025, more than 100,000 new diagnoses are expected in the United States. But there's good news. When detected early, prostate cancer is highly treatable and even curable. Unfortunately, many men don't pay attention to their prostate health until problems arise, and by then, the disease may have already progressed. The prostate is a small gland, about the size of a walnut. It's located just below the bladder and in front of the rectum, surrounding the urethra, the tube that carries both urine and semen out of the body. This gland produces fluid that makes up about 30% of semen, helping to nourish and protect sperm. It also plays a role in the muscle contractions during ejaculation. So even though it's small, the prostate is essential to male reproductive health. The problem is, many early symptoms of prostate cancer are subtle or mistaken for normal aging or benign conditions. That's why it's crucial to recognize the early warning signs. In this video, we'll go over 12 early symptoms that may signal prostate cancer. These symptoms might not seem serious at first, but being able to identify them could make the difference between life and death. Have you ever noticed blood in your urine? This symptom, called hematuria, can be an early warning sign of prostate cancer. The blood may appear red, pink, or brown, or it may only be detectable under a microscope. While other conditions like urinary tract infections or kidney stones can also cause blood in the urine, this symptom should never be ignored. Another sign to watch for is difficulty urinating. You may struggle to begin urinating, have a weak or interrupted stream, or feel like your bladder isn't empty even after going. These issues can occur when the growing prostate presses against the urethra, making it harder for urine to pass. Some men even experience the inability to urinate while standing. They find it easier to urinate while sitting, which may indicate that the enlarged prostate is obstructing the urinary passage. If you notice such changes, it's time to see a doctor. A burning sensation while urinating or during ejaculation can also be a warning sign. This discomfort might be due to inflammation or irritation caused by a cancerous growth within the prostate. While infections can also cause this symptom, if it persists, it should be checked immediately. Frequent urination, especially at night, is another symptom. You might wake up several times during the night to use the restroom. While it's normal to urinate more with age, sudden or extreme changes in your urination habits could be caused by the prostate pressing on the bladder or urethra. Unexplained weight loss is something many people overlook. If you're losing weight without changing your diet or activity level, it may indicate something more serious. Cancer can affect your body's metabolism and energy use, leading to noticeable weight loss, especially in more advanced stages. Bone pain is another symptom that can signal prostate cancer, especially when the pain is persistent and not linked to any injury. Cancer that spreads from the prostate often travels to the bones, causing discomfort in areas like the hips, spine, or ribs. Persistent fatigue is another warning sign. It's not the same as being tired from a long day. This fatigue doesn't go away with rest. It can be overwhelming, making even simple daily tasks feel exhausting. It may be a result of the body fighting the cancer or the tumor, consuming your energy reserves. Some men notice blood in their semen, known as hematospermia. This can be caused by cancer interfering with the blood vessels in the prostate. While it might also occur after certain medical treatments, if it happens frequently, it needs to be evaluated. Numbness, tingling, or weakness in the legs or feet can occur if the cancer spreads to the spine, pressing on the nerves that control the lower body. This can make walking difficult, and in severe cases, it can even lead to paralysis or loss of bladder and bowel control. Discomfort in the pelvic area, lower back, or upper thighs can indicate that prostate cancer has spread to nearby tissues or lymph nodes. This type of pain typically worsens over time and isn't relieved by standard pain relief. And finally, there's erectile dysfunction. While there are many causes for ED, when it comes on suddenly and without explanation, it may be due to prostate cancer or a result of treatment like surgery, radiation, or hormone therapy. These treatments can damage the nerves and blood vessels involved in sexual function. Now that you understand the symptoms, it's also important to explore what causes prostate cancer. This disease begins when normal cells in the prostate mutate and begin to grow uncontrollably. Some of these changes are inherited. For example, men with mutations in the BRCA1 or BRCA2 genes better, known for their link to breast cancer also, have a higher risk of prostate cancer. However, most mutations happen during a man's lifetime as cells replicate and make errors in copying DNA. Other risk factors include age. Your risk increases significantly after 50 and even more after 65. Family history also matters. If your father or brother had prostate cancer, your risk doubles. Race plays a role too. African American men are more likely to develop aggressive forms of prostate cancer and die from it. Lifestyle choices also influence your risk. A diet high in saturated fats, red meat and dairy products may increase risk, while diets rich in fruits and vegetables may lower it. Obesity is another key factor. Men with excess weight are more likely to develop aggressive prostate cancer. Smoking, lack of exercise, and heavy alcohol use can also raise your risk. Now, let's talk about prevention. While there is no guaranteed way to avoid prostate cancer completely, there are powerful steps you can take to reduce your risk. Start with your diet. Choose foods rich in antioxidants, vitamins, and minerals. Tomatoes, for example, contain lycopene, a compound linked to reduced prostate cancer risk. Omega-3 fatty acids found in fatty fish like salmon and sardines may also offer protective benefits. Maintain a healthy weight. Obesity doesn't just increase cancer risk, it also makes treatment more difficult and recovery slower. Losing even a small amount of weight can have a positive impact on your overall health. Stay active. Aim for at least 150 minutes of moderate exercise each week. Regular movement helps regulate hormones, reduce inflammation, and strengthen the immune system. Don't smoke. Smoking increases your risk for almost every kind of cancer. If you smoke, make a plan to quit. It's never too late to make a difference. And most importantly, get regular checkups. Talk to your doctor about prostate cancer screenings. The PSA blood test and digital rectal exam are simple tools that can catch cancer early, often before symptoms appear. Taking charge of your prostate health is one of the best things you can do for yourself and your loved ones. Don't ignore the warning signs we've covered in this video. Listen to your body, make healthy choices, and take action early. If you found this video helpful, please like and subscribe to our channel. Share this video with the men in your life, your father, husband, son, or friend. You never know whose life you might help save. And finally, here is a question for you. What steps are you taking to stay proactive about your health? Leave a comment below. We'd love to hear from you. Thanks for watching and stay healthy.